Hello, my name is Nicholas Kalika Akahane Kawasaki. I was born and raised in Honolulu, Hawaii, and I got my undergraduate education from Johns Hopkins University. I'm interested in cardiovascular health because of my personal family history, and I now study under Dr. Takashi Matsui. So, a little about me. When I was young, my great-grandfather suffered from myocardial infarction. Well, not just one, he suffered from multiple myocardial infarctions. But, resulting from it, he needed a triple bypass graft to save his life. My great-grandmother, on the other hand, was so shocked from the whole event that she then took the schematic of that graft, put it in a frame, and then posted it for everyone to see, just to remind my great-grandfather to maybe use a little less salt next time. From there, I went to college, and then I shadowed Dr. Derek Pang, a cardiologist, and I really started to understand my actual interest and curiosity for cardiovascular health was formed when I got to see him explain and talk to patients about their medication and the cardiovascular diseases and how they need to change their lifestyles. Subsequently, I'm now obtaining a PhD in developmental reproductive biology from the University of Hawaii at Manoa and studying under Dr. Takashi Matsui. So our research is in ferroptosis and ischemia reperfusion injury. So let's start at ischemia reperfusion injury. Before the 1960s, there really wasn't a lot of interventions if you had some form of blockage in your heart. Blood stopped and that was pretty much it. After that, we then found stents, we found grafts, which allow blood to be restored. But from that restoration, we then found that cells would start to die off. You would have these injury zones appear where instead of healthy cardiovascular tissue, you would instead have non-functional fibrotic tissue, thus reducing the actual action and ability of the heart itself to pump. So from this, it would be more likely for individuals to experience myocardial infarctions in the future. Thus, we are trying to understand what the mechanism behind that reperfusion injury and what is happening after blood starts to flow again after it's stopped. So, other labs have found through T2-star MRI imaging that there is myocardial iron in those, basically injury zones, those infarct regions. And so thus, we've hypothesized that ferroptosis plays a role in it. Ferroptosis is a newly found within the last 10 years form of regulated cell death, which focuses on dysregulation of iron. This dysregulation of iron often overloads antioxidant pathways, resulting in large amounts of free radical formation through lipid peroxidation. So in our lab, basically, we're trying to understand the mechanism behind reperfusion injury, and we think that maybe through either using ferroptotic inhibitors or antioxidants or some form of iron statins, there would be a way to actively reduce reperfusion injury. Now, this is greater for the overall community because Hawaii as a whole and the Native Hawaiian population that resides in it has both a history of cardiovascular health and cardiovascular diseases. Thus, with heart failure being pretty predominant among the Native Hawaiian population, we find that this is an important subject to actively study here in Hawaii and to study for the greater workings of the community. Thank you.